In. Welcome everyone. Thank you so much for joining us for our Northeast CPI session 8. It's great to have you today. Next slide, please. As always, this session is being recorded and will be made available to you after the session as well as the slides. Next slide, please. Next slide. If you could make sure that your Zoom name is updated and include the name of your organization. And then our chat icebreaker for the day is if you could please share your favorite kitchen appliance in the chat. So I'll give you a second to all do that. But as always, we really want this to be a dynamic session. Please feel free to use the chat and also come off mute or raise your hand if you have any questions or feedback. We really love to hear from you and love to have your voice in the room. So yeah, if everyone could do the icebreaker, what's your favorite kitchen appliance? Yeah, Kessler and skillet is a really good one. That might be mine as well. But it's hard to choose for me. We can go to the next slide. So welcome everyone. Thank you for joining us. For those of you that are less familiar with the collaborative, or maybe if this is your first time joining us, we're really happy to have you here. This is really a space for CalAIM stakeholders to collaborate, identify challenges, and problem solve with the goal of improving CalAIM implementation. And this link here, which will also be shared afterwards, includes all of our session materials and all of the decks. But also just want to take a moment if there is anyone new to the collaborative. If you either want to introduce yourself in the chat or come off mute and say hello, we would love to meet you. So I'll just pause there for a minute in case we have any new folks.
Hi, Eva. Can you hear me?
Yeah, hi.
Hi there. My name is Paul. Thank you so much for the invitation. Everyone, my name is Paul K. Sanchez. I'm with Point Click Care. And thank you, Eva, for inviting Point Click Care here. And I'm looking forward to kind of learning more what the CPI discussions are, and happy to kind of support the office hours later as well. So glad to be meeting with all of you. I'm with our solution. Sorry, I forgot to say I'm with our solutions design team with Point Click Care. And basically, what I do is I work with clients making sure our solutions fit the business case and the problems that they're trying to solve. And I'm also supporting our CalAIM initiatives and ECM work at Point Click Care.
Thank you so much, Paul. And we'll talk about this a little bit later. But yeah, Paul and Point Click Care are going to be joining us directly after the session for office hours, and they'll be able to do a little demo, answer any questions that anyone has about Point Click Care. So that'll be a really great opportunity. So if you're available to stick around after the session, it'll be on this same Zoom link. They'll be there to answer any questions and serve as a resource. So that's a great opportunity. Next slide, please. So our objectives for the day, by the end of the session, you all will receive important updates and resources related to an upcoming in-person, as well as any policy updates. We'll have a chance to follow up on next steps related to improving regional provider referral coordination. And then also we'll have a chance to learn about best practices related to treatment authorization request workflows for ECM. Next slide, please. So to give you a sense of what this is going to look like, after we finish with a little bit of level setting, we'll move into the updates and resources, talk about next steps in improving provider referral coordination. We'll have a chance to talk about those TAR workflows, and then we'll close out with some next steps. And then, as I mentioned, directly afterwards, we'll have those office hours for anyone that can stick around. Next slide, please. So to start us off with some updates, we have an upcoming in-person session. We have a date that will take place on September 24th at 11 a.m. At the Northeastern Rural Health Clinics in Susanville in Lassen. The flyer is linked there. We'll also drop a link in the chat as well as the registration link. But this will be a really wonderful opportunity for everyone to get together in person, really have a chance to network and have a chance to kind of continue conversations we've been having about provider referral coordination. And we'll be able to share best practices, do some solutioning. But I know for anyone who's attended one of our in-person sessions, it's just a really great opportunity to see each other and have in-person conversations and really work on peer learning and skill building together. So we're really excited for that opportunity. But please, yeah, Navneet just dropped the registration link in the chat. Please be sure to register. We do have limited capacity, so you want to make sure to register early, and please reach out if you have any questions about that.
Hey, Eva.
Next slide. Yeah.
I'm sorry, this is Amber. Can I just
Yeah.
say I just so appreciate you guys like making sure it's held in like different parts of our region. And Susanville in the fall is really gorgeous. So I just wanted to say thank you. I really appreciate that.
Yeah, thank you so much, Amber. I know that you mentioned that the drive from Reading to Susanville is really beautiful. So if that can encourage anyone to make the trip, I hope that's an incentive. But thank you so much, Amber. And then related to the in-person session, next slide, please. We're starting to draft the agenda for that session, and we would really love to hear from you about what you would like to see included on the agenda. We want to make this session as helpful and valuable as possible for you all. And so if anything comes to mind right now, please stick it in the chat. We are keeping track of all these suggestions and we'll do our best to incorporate them all in the agenda. If something comes to mind later, feel free to send me an email. My email is there in the slide. But we'd love to hear from you about what you would like to see in this session. And then I think we can go to the next slide and I will pass it to Gretchen.
Thanks, Ava. Hi, everybody. Hope you're doing well on this Tuesday. Happy to be with all of you. So we wanted to bring this opportunity to you for a chance to give feedback to the state on some draft guidance that they have rolled out. As I think we've talked about this before, maybe at our in-person session in June, the state is going to be requiring the managed care plans to do closed loop referrals starting in January for ECM and community supports. And they've rolled out their draft guidance for what that should look like and how it should work. And so they're asking for feedback from all of us and the CPIs and from ECM and community supports providers. Of course, it's a pretty short turnaround time. It's September 4th, but I just wanted to raise this up and let you guys know. And thank you, Navneet, for putting the guidance in the chat there. It is a little bulky, I will say, but you can read through it, and there is towards the bottom some information that are specifically addressed to ECM and community supports. So I really encourage you to look at it and then send in your feedback by September 4th in the emails listed here on the slide. Next slide, please. So another just reminder, just want this to stay on everybody's radar here. So the last round of PATH cited, we're still waiting for them to actually announce the date that they're going to open applications. We're still thinking October, November. Unless, Ashley, you've heard anything different, we're still waiting to get the final word on that date. But just wanted to keep that on your radar here. So if you do want to apply for this last round of PATH cited, you can keep working on your application, keep thinking about what you might need dollars to do to help with ECM and community supports. And so when it does open, hopefully October or November, we can jump on that application and get that submitted. We're also still waiting to hear the announcements on who was awarded round 3 PATH cited funds. We keep hearing the fall for that too, but we don't have an exact date, but we are looking forward to seeing who all got funded. Next slide, please. Here we go. Keep going with our announcements. TA Marketplace. We talked about this last month. I really want to encourage all of you to look at the TA Marketplace. I think, Amber, you had been really brave and clear with saying what a cumbersome process it is, and it takes a little bit more than a few minutes to really dig into this. But this is a great resource if you all need any consulting services around ECM or community supports. The TA Marketplace does offer those, and they are paid for by the state. So a really great opportunity. So we encourage you all to look at that, and applications will be accepted through 2026. So we have a long time to look at this, but I think it's a good idea. You may need some consulting now and then additional TA later on in your program implementation. Next slide, please. All right, I think this is our last update slide here. So we have a new benefits guide coming out from the state around PATH. There's really not anything new in this guidance. It's more just around looking at what things you are eligible for based on your ECM and community sports contracting status. So just really being clear about that. And we have a great visual here at the bottom of the slide to demonstrate that. But this is available. It is nice and clean. So check that out. Next slide, please. All right, I'm going to stop talking for a few minutes now. Enough with the announcements. Would love to open up the floor to folks who may have announcements to make to the CPI or success stories you want to share. I always love hearing about the different successes folks have seen with their clients. So yeah, I'll open the floor up. Whoever wants to jump in, please do so.
I have a success story to share.
Thank you, Amber. I love it.
Yeah. So we do Schatz Community Health Center does ECM and community supports, and we have had a really good success with our housing transition and navigation services recently. We've been able this year so far to get 11 individuals housed, and they've all stayed housed. And we've got like 3 potentially that might get housed this month actually. So really proud of my team's work that they're doing on that. And
that's fantastic.
Yeah, I feel I'm really proud of their work. And I also did want to just like on the closed loop referral thing, Gretchen's right. It is pretty tedious, like it's not a light read. However, I would encourage everyone to read it. I got the opportunity to read it this weekend, and I do have like questions that I'll be forwarding on just about how this is going to impact us. Because even though it's on the managed care side, we all know we do already a lot of reporting. And so if managed care is going to have to do a closed loop, like I am curious how it's going to impact our workload. So I would encourage everyone to like really read it. I had to read it a couple of times to kind of understand like what DHCS's like intent was, but also then thinking through how it might impact us. So I just wanted to like echo those words.
Thank you, Amber. Yes, and thank you for slogging through it. It is kind of a put you to sleep kind of read, but there are some key points towards the back with ECM and community supports. And I love all the housing success. Anybody else want to share any successes or announcements they have for the rest of the group? All right, well, if you're so moved throughout the rest of the presentation, please put it in the chat. It always inspires me to see the great work that's happening and the successes that all of your hard work is generating. So keep those coming. All right, now we're going to jump into our provider referral coordination follow-up. We've been doing this for a few months where we, I think in June in our in-person, we identified a bunch of organizations that we felt were missing from our CPI table that we wanted to get to know and bring into the conversation around ECM and community supports. Here is a list there. And then I think last month, Amber, you were very encouraging of our outreach ambassadors to reach out and invite folks to the CPI meetings. Speaking of the next slide. So we just wanted to check in to see how those ambassadors felt with the outreach template that we sent out. If you had a chance to send emails to any of these organizations to invite them to CPI and kind of what happened. Does anybody want to join us and let us know how it went?
Is someone from Pathways to Housing on? I'm looking at all my boxes. Because I know Alicia took an opportunity and she reached out to Good News Rescue Mission. So Sarah, you can make sure to let her know I gave her a shout out.
Wonderful.
Marcy, I can't remember. Were you gonna talk to some folks?
Yeah, I did. I did try to So I'm a little confused about the link and what exactly to do. So I did try clicking on the link on my computer, I think a few days ago, but it took me just to like register for a Google Docs account, which I'm not sure how I'm supposed to send that to somebody and explain how they're supposed to go ahead and access that. So I didn't do it that way, but I did send an email over, I think I was supposed to contact Northern Valley Catholic Social Services, which I did contact Wendy Taylor, and she was going to get back with me after all the managers had their meeting together and let me know. And then I think it was SCOE, but I hadn't had a chance to reach out to SCOE yet. So
Marcy, thank you for doing that. And I don't know if anybody wants to chime in about how to get around the Google registration issue. Well, I appreciate, Marcy, that you figured it all out and did your own outreach. Thank you for being the outreach ambassador here.
so my question is, so do I invite them to the in-person meeting next month?
Be great.
Okay, and then just give them, maybe forward them my email that I receive?
Ava, I'm going to look to you. Do you want to have them
Yeah.
send their information to you and you can send out the registration link, or what's best?
Yeah, so feel free to share the flyer, the registration link with them, but also if you want to forward me, anything, something with their contact information on it, I can
Okay,
make sure they get added to our outreach list, and then everything that you receive, they will also receive as well.
okay, great. I'll do
Yeah.
that.
Yeah, thank you.
Hey, Ashley, can I ask a dumb question? Ashley Peel. I think I saw her. Or it's a really dumb question because I'm talking to someone who's not on there. That would really suck.
I'm here. Sorry, my
Oh.
phone wasn't letting me unmute. Hi.
No worries. I was like, I swore I saw Ashley's name. Do you know when someone gets like signed up with ECM or community supports in our region, do they get all the Health Begin stuff? Like as like a welcome, you're a provider. These people can help you with stuff.
Question.
That is a great question. I think us and Health Begins and the other collaboratives probably need to communicate on a warm handoff process. I think that there's room for opportunity of improvement there for sure. I think we are compiling a list on a quarterly, correct me if I'm wrong, Health Begins folks, but I think we're compiling a list on a quarterly basis and then sending it over. So if we need to do a more frequent notification, I don't think that's been included in the startup documents that they received from partnership, but I'll take it back and see how we can improve that.
Yeah, that'd be cool. I know like if there would be a way, even like congratulations, your contract signed, like here's some information, even if it's just like for them to reach out to Health Begins. Because I can think of like 5 new people that I know that are like trying to figure it out. And it would be cool if we were all working off the same consistent information. So I think that'd be awesome.
Yes, 100% agree with you. We've been talking internally like a specific welcome letter, just because our providers get the generic welcome letter once they're done with contracting. And it says like a representative will be at their office in a couple of business days to provide training. And we know that's not the case for ECM and CS. So definitely good feedback for improvements there. Thanks, Amber.
Thank you, Ashley. Appreciate you.
Great ideas. I love all this collaboration. Thank you both to Amber and Ashley. That's wonderful. Any other outreach ambassadors have updates they want to share? Or if you added on to the outreach template that we sent out, let us know. Are there any other things that we could do, again, besides Amber's suggestion of getting the CPI information into the partnership welcome letter? Anything else that could be done to help do outreach to other providers that are either in the process of contracting, newly contracted, or have not yet joined our collaborative? Any other suggestions? All right, well, if you think of anything, let us know, because we always want to make sure we can give you all the tools you need to do outreach and to really improve the referral coordination and outreach efforts to make this successful. All right, and Sarah, I see your comment in the chat. So yeah, appreciate whatever updates you have on your ambassador doings. So maybe next month you can let us know where things are. That'd be great. All right, so now that we've talked about doing our outreach, our ambassadors, we do want to move into talking more about our provider registry. We've talked about this for a few months, and thank you to all of you who have actually added your information into the provider registry. If we can go to the next slide, that would be great. We did just want to kind of bring this back up again as we look at all the resources that we currently have available to really, encourage referral coordination, improve care coordination, to work on just building a stronger community for ECM and community supports. We do believe the provider registry has a lot of benefits that can help all of us do our work even more efficiently, more smoothly. So we created this little wheel kind of as a value proposition for our provider registries to think about what are all the ways that these registries can actually help you do your work. And I think, please add more here. So I think one of the big things I think about is it just facilitates data exchange. So it facilitates conversations between providers, it facilitates care coordination, communications. I think it can improve our data and accuracy and quality. So looking at how do we think about what information needs to be shared as we build ECM and community supports, how do we do better care coordination? How do we streamline our processes and become more efficient with referrals, with collaboration? I think all of that can be part of our provider registry. So if we go to the next slide. So if you have not yet filled out the provider registry, I wanted to give you guys an opportunity with our lovely QR code here on the screen to go ahead and do that. And I think one of the key things, and Ashley mentioned she sends out provider information to Health Begins once a quarter. But I think what this actually does is allows you all to update information in real time. It allows you to think about putting a contact point person in there. So if I want to talk about referrals, who can I contact at your organization? If I have a question about collaboration, who can I talk to? So thinking about who is that point person that folks can reach out to really ensure that we're exchanging information and working together on this. It also, I think, really helps us think about how we can sort information and how do we find people. If we want to make a referral for community supports, how do we know which organizations are doing which community supports? And so part of the piece here that we also want to highlight is that we do have a downloadable form that you can download and then you can sort. If you're looking for an ECM provider who does a certain population of focus, you can sort through that. So thinking about how to use that as well. So take a minute, update provider registry, fill out your information. We'd like to get as many folks from our CPI in here as well. And of course, as we get more data in here, we'll have better data to use for all of the different pieces of referral coordination, care coordination, and many other things as well. Oh, and Marcy, I just see your little chat that you sent an email to Maggie Wisco. You're awesome. Thank you for doing that in real time. Fabulous. Any questions or comments on the provider registry? You're too busy typing, filling out it. Okay, great. We'll move on then. So now we wanted to spend some time in our CPI just talking about workflows. And I think there's a lot of different things we can look at, but we really wanted to start out with looking at the ECM TAR workflow. And for this, I'm going to turn it over to Amber to help guide us in this conversation.
Awesome. Thank you. So I want to look at this as like a workflow or like a process development piece. I know one of the things I've seen in the development of ECM and community supports, and you guys please correct me if you feel different, is for those of us that were whole person care counties, we were able to kind of like just integrate our whole person care process in terms of how we work with clients pretty easily into this. But for those of us that weren't doing whole person care, there may have been some wonders of like how to deliver this service. And we spend so much time in ECM learning about like the QIP and the RTF and the IoT that maybe we don't put as much thought into like what this is actually going to look like when we start doing service delivery. So that's what I want to just talk about for a minute. So when you're approaching kind of how to prepare your team for delivering ECM services, these are some things I just like to walk through. So that I believe are universal. So for one is, what is your target population going to be? So Amanda, what organization do you work with? I know you're muted. I'm sorry. I did that to you.
Dignity Health Connected Living.
Okay, cool. So like you guys do the food banks and all of that. Are you doing ECM as well?
Yes.
Yeah. So, you know, one way to look at this is really easily is like when Amanda's setting up her program, it's just going to be like, well, this is the target population that, you know, is covered under ECM. So we do it all. But the reality is, I would imagine there's some things that connected living just does better with certain populations than others, right? So for my organization, we're a homeless healthcare organization. So we really like needed to focus on like, that's one of the areas we wanted to excel in. So I think it's always important to think about what's your target population and also thinking about who's your team trained to work with. So if connected living is suddenly going out into the field, that's going to look a little different, right? Than if they're working with people who are coming out of skilled nursing facilities. Allison, where are you from? Allison Gonzalez. I know you're on mute too. I'm sorry. Maybe we'll come back. Same thing, like Allison has like a specific area that she works with and is targeted in. So another thing I like to think about is what resources are you comfortable with? And also what are the gaps that your team is going to need? So we just recently started taking referrals with children. And so that's a new area for us. And we're having to build up our whole resource around what we're going to work with kids and what can we handle with that. So how many of you guys, by show of electronic hand, thought at all about the acuity level that your team can manage? Has that been thought about at all? I see Amanda shaking her head. I see no other hands up. So I'm going to assume that either that hasn't come up or maybe like you guys just feel really comfortable with acuity level and that's cool. But like we have to really pay attention as an FQHC what we can take on and what we can't, because and also think about like what your team's been trained to handle and what your team can't. And all of this really goes into caseload size, right? So if you're paying attention to how big your caseload needs to be so you can sustain your program, you really need to be thinking about the acuity level that you're going to be managing. So if you're going to be taking a lot of people who are coming like out of encampments that have high medical issues, you may not be able to take that many onto your caseload because your team isn't prepared for that. Some of you guys weren't doing in-person work, you know, with your clients. You were doing lots of telephone contacts. And if you are looking at ECM is really meant to be delivered in person as much as possible. And if you've chosen a population like the homeless or high utilizers of emergency services, they're going to need a lot of touch points, right? So again, if you're thinking through caseload size, acuity, if your team is going to be switching over to in-person, then that's some training ideas that you need to think about. Marcy, I think about you, like you're an expert in housing. So that like may have not been an area that you really needed to grow in, but there may be some other things like in terms of acuity, working with people who are in encampments, that may have been a stretch for you, right? What do you feel most comfortable with, Marcy?
You know, I had to look up the definition of what acuity means.
I get it.
And so yeah, I don't think we've ever taken that into consideration. I know personally I've been, you know, advocating for somebody that's working especially hard or is living out in a tent or, you know, living in harsh conditions. So, I mean, there's that part of what I've done in order to help others. But as far as what Sacramento does, you know, we've never had that conversation.
Yeah, and you're in kind of a tricky spot because you
Yeah.
guys are spread out.
Yeah.
And so what may work good for you may not be what works good for Sacramento, right?
Yeah. Yeah.
And
Yep.
then the other thing I like to talk about a lot with my team is how we define engagement. And that might be a little bit different than what partnership's talking about with engagement. But like I have a high expectation of my team that they're like making, some frequent contacts in different spaces. And so again, when you're thinking about caseload size and putting in that TAR and all those sort of things, these are things that I think it's important. If you are the one doing the line work, you need to be talking to your leadership about these things because they're not like, especially if your leaders have never done case management before, they're not going to have these things on their radar and they may be setting up a program that isn't really sustainable. And if you're in leadership, like vice versa, right? You need to be thinking about, is your team prepared for these sort of things? And I always like to think about what happens, this is kind of before DHCS talked about a closed loop system. Like I want my team, if someone's not going to open up a case with us, like if they're not going to do ECM with us, I want them to still know like they can come back, where they can get other resources. I don't want anyone walking away without something tangible in hand. So when I'm thinking about how we prepare our team for delivering ECM services, there's all the technical parts, right, that we need to do to be in compliance with partnership. And I 100% support getting all the training. And I also want you guys to be thinking through the programmatic pieces too, because I think when we marry those two together, that's when you get a really solid program. Thoughts? Thumbs up, thumbs down, thumbs sideways. All right. I think my slides are done. I don't remember one after this. We'll see. No, same words I just said. So you're covered.
I actually have a question though. I'm just trying to think about, Amber, as you talk through this and how do we prepare our team? So how do we provide services? How does this tie into payment for all of this? Like, have you been working through how setting things up in a certain way will lead to getting paid more efficiently or getting, cleaner claims? How does that work? If you could kind of talk more about that, I would love to hear it.
Yeah, so I believe if you go slow in the beginning or set your system up effectively, then you are going to have a pretty efficient system. So one of the things we did really early on is we brought our billing team into the conversation and made sure like we were walking like just side by side step with their process. So we actually do pretty well with our reimbursements. And I'm very lucky. I have two lead staff and a great center manager on my team, but they meet weekly with billing to go over all of those things. And we also have pretty frequent meetings to talk about the programmatic side, right? So the payment side, we've got covered, and then we're also working on the programmatic side. Another thing that we do is, hang on, my brain left me for a minute. It came back. I have figured out a formula of kind of what I need to be able to cover my costs. And it ebbs and flows, but between ECM and the community supports we do, like if I have a certain ratio of those, so I always have a goal to set for my team of what I want caseload sizes to be. And we're not there yet, but we're pretty close. I don't know that my team always appreciates it, but I'm also transparent with them about the why around it. When programs are able to be self-sufficient, then we can use the grants for the fun stuff. And you don't have to worry about your employees like losing their jobs or anything like that because you're self-sustaining. And what that means for our community is self-sustaining services for a high-risk population that we know is going to need frequent touch points before like things stick for them. So that's like why I think for ECM and community supports, you really need to look at your long-term sustainability.
On the community support side, is there anybody who wants to share how they've been thinking about a similar workflow?
You guys are all very sleepy today.
I was gonna say, I know it's hot.
I do appreciate, because it's hard to manage the mute and not mute button, but you guys are all deep in contemplative thought today. Marcy, I'm going to pick on you because you're on camera, and
No problem.
I know I just met Amanda, so I don't want her to hate me already. And yeah, but what are your thoughts? Because you've been like, this is not your first rodeo with community services. Like, what are your thoughts around it?
So let me just see if I am understanding. You're wanting to know how we gauge the most important person to contact versus maybe that doesn't need the services.
It could be that, but also like, are you guys talking about at Lutheran Social Services? Like, do you have kind of a goal of what you want your community supports program to look like in Shasta County?
You know, I'm sure Samantha has talked with me about what that looks like. Here, we've had conversations here and there. But no, we haven't. She hasn't explained what her overall view of what it's to look like here. I do want to say though that my caseload has pretty much doubled over the past year, and we are hiring another ECM, so that way I have the opportunity to really do a better job, because my caseload is a little high, and so I feel like definitely that I needed some help with that. But no, I wish that we should have that conversation more. And you know, that gives me the opportunity to ask her what are her views, so that way I could represent the county more, because she's not attending these as often. You know, she's over there in Sacramento and it's just me here. So yeah, I'll definitely have those conversations with her, so that way I can share.
Yeah, that's really cool.
Yeah.
And I know Amanda at Connected Living, you guys have like really kind of been going gangbusters with your community supports. Like you've really mobilized a lot of different things around that.
Yes, we have. With the respite, we're kind of piggybacking off of our ADHD, so that's very helpful. And then Shannon, who I believe is on here, knows a lot more about what's going on with the MTM side of it.
I am. I'm just juggling a call for flooring. So I keep going back and forth between my phone and he's calling me back. So yeah, we've expanded not only to Shasta County, but other counties as well. So we're working on that. And I kind of do what Amber does. And I decide, okay, how many people do we need in a county to logistically drive that far? So I have that kind of thing. But I'm a number cruncher anyway. So I like to do that kind of statistics kind of thing. Right now, we're really working on how to go back through and do like quality control on things. I mean, we're doing assessments and things like that, but to really go deeper into the outcome of what we want. I was going to share a success story of a call that we received of a mother that actually had her son, that's an adult, struggling with things, that was on medically tailored meals. And it's just heartwarming how encouraged that he is now in taking better control of his choices and all that kind of good stuff. So I won't pull that up, it'll bore everybody. But I mean, there's good things happening. And so when we find those good nuggets, we're like, yes, that's it. We're starting doing some cooking classes on site for our seniors with another agency that we're partnering with. We're doing that. So later we can help build on education and actual changing of the behaviors for clients. So, I mean, we're moving towards good things. Nothing really to report yet as like a launch date, but good things are coming. And those are all in the plan of strategic, you know, of what you want to have outcomes for community.
I think the cooking classes is so cool, Shannon. That's awesome to hear.
Yeah, it's on the pipe dream list. Yeah. So we're working on a community garden in the back that they'll be able to garden and then harvest and then do cooking classes based around, you know, diabetes or congestive heart failure, things like that, that they can do on their own as well.
That's super cool.
Thanks.
That's super cool. And I know like there wasn't a lot of talk about the registry, but what I just want to go back to like, what is your target population? Like this goes back to the registry. This goes back to how we work together and not compete. And also, if you know that you have all these people doing certain populations, like you can be strategic with how you build up your caseload sizes in your agency. Like this is how we continue to like build a community of services for our folks. So I think that is just like a tie back to that piece, because the registry is only as good as how actively it's used and how it's maintained. So we want to like really stay focused on that.
I agree with that, because there's been times that we've gotten referrals through partnership for children with diabetes and things like that, and that is just not our focus.
Yeah.
So it would be nice to have a warm handoff to somebody that we could say, hey, we can't help you, but we know somebody that can.
Yeah.
Looks like Delaney had a question about what folks will actually have access to when the registry is completed. Gretchen, do you want to speak to that?
Sure. Well, I think it's not ever going to be completed, because hopefully it's going to be this living document as folks, come and go, and as staff changes, we can keep that updated to make sure we have the most accurate information. But what we want to do and want to make sure it's useful for you all is that when the registry, and actually this can happen now, you can go in and download a form. And I believe it's in Excel right now, right, Ava, not SurveyMonkey?
Yes.
And you can download that, and then you can start to sort information. So if you're trying to find a provider in one of the counties that serves a certain population of focus for ECN, you can sort just by those criteria, and it will show you who all is contracted or in the provider registry. So of course, the data is only as good as what's in the registry, but it will allow you to sort for that. And if you're looking for a certain population or a certain community support service, you can look and sort by that as well. So it can be really helpful to have multiple search functions in this Excel spreadsheet. And hopefully this will be useful to all of you all. Thank you for asking that, Delaney. All right,
I'm all done with my slides.
I was going to say, anything else for Amber or anybody else on some workflow ideas or how you think about doing things in this way, and how do we tie it into caseloads? How do we tie it into payment? All of that good stuff. All right. Well, thank you, Amber, for leading that conversation. That was really, really great. All right. So I think we can go to the next slide, please. All right. I'm going to turn it over to you, Ava, for next steps.
Great. Next slide, please. So as always, this is a lot of information, and everyone is sort of, at a different stage in their journey. So if there's any point at which, you all would like to meet with us for a one-on-one, we are available. You can send me an email, and we can go ahead and schedule a one-on-one to provide additional background information or connect you to partnership or discuss different strategies for anything that or any challenges you're having. Additionally, we have office hours like we're going to have directly after this session. Again, Point Click Care will be there to discuss their platform and really how to leverage that. So please join us directly after the session for those office hours. And we can go to the next slide. So we'd love to hear from you all what section of today's session was the most valuable, just so that we can continue, really trying to provide the most, helpful content moving forward. So just take a second to fill out that poll. All right, and it looks like a pretty even split, which is great. But we can go ahead and end that. Thank you for your feedback there. And then we can go to the next slide. So we also would love to get a temperature check from everyone that's here today. We know that, the justice involved population of focus and the justice involved work is ramping up. Things are kind of taking place at different times depending on the county. And so we would just love to kind of see what your questions are to help us better inform, the information and the resources that we're providing moving forward. So if everyone could just take a second, if you have any questions top of mind about JI, please drop them in the chat. And then again, if anything else comes up later, feel free to send them to me in an email, and we can make sure that we integrate those in our future sessions. Gretchen or Amber, anything to add here kind of about, what we're seeing with JI, what's coming, down the pipe?
I think, there's two parts. There's the adult justice, and then pre-release will start for some folks as that's coming along. I know one thing that I started to do is I'm reaching out to our probation contacts to develop some primary referral sources. So I think all of you guys who are doing ECM, we know that the referrals we get from the MIF sometimes are not they're not as lucrative. For my agency, it takes a lot of work, and then we don't necessarily get a lot of turnout from them. So I would encourage you guys, if you're looking at getting involved with JI, to start working in your communities about how to build up those referral relationships. So I know that's something we're targeting.
Great, thank you, Amber.
How many of you all on the call today actually serve the JI population of focus for ECM or community supports? Anybody raise their hands? All right, I see a few folks. Okay. So I know there's a lot coming, in the next year or so for the pre-release services, but are there some things that would be helpful to have conversations on or topics discussed around serving the JI population post-release right now?
I would say housing stuff, because that sometimes can be a real burden to get people involved with the JI population in housing, and then where they're going to be in the meantime. I think that would be helpful. Tracy, is Mountain Valley's doing justice involved stuff?
We are. We haven't had any pop-up though.
Okay.
I think just in general how to deal with it when it does pop up.
How do you guys feel like you're set for resources for that population?
That's a good question, and I was also kind of thinking of that as you guys were talking. Is since we haven't encountered it, maybe just where to start with resources, and like you said, with housing and dealing with the issues that come along with that.
Yeah, because you guys are, you're already compacted with what you have available. So I would imagine that's going to be an area you have to be really creative in.
I think so, especially we're pretty rural and limited. So a lot of the times we tend to have to refer into Reading or into a bigger area for certain resources.
Yeah, you guys have to be super creative.
Yeah.
You nail it every time. I just, it's like an extra workload you have to do.
It is. There's lots of navigating, and then, of course, transportation to get people where they need to go, but that's kind of the easier part.
There might be some cool conversations about that up in Susanville too, because they have they have the prison there, and then they're also a remote location. So they might have some different strategies too.
That's a great idea.
Yeah, that's exciting. I really want to make it to that.
All right. So
yeah,
go ahead.
I was just going to share that I was talking to the venue today, and they were saying that they are going to outreach the prison as well. So we might have some perspective from them.
That's cool.
That'd be great. If we can get probation, any of the county probations to show up, that'd be really helpful too, to kind of hear how we can work together.
This is kind of a pre-release thing, but I think one thing we might want to understand is what happens with people's partnership when they're coming out of incarceration, and making sure that we all know how to connect them up with the right resources in our county. So it's more of a like it's supposed to be happening pre-release, but we know that that's going to be like a bumpy transition. And we'll have a lot of people show up at our homeless healthcare program, you know, who are coming out, but they don't have partnership yet. So I think that could be a good conversation point, especially if certain counties are impacted by getting people enrolled. That might be something too.
And Ashley, are you still on the call? Let me see. Yeah, I'm just wondering if partnership has any trainings already in development around this, or could speak to this a little bit more, because that'd be really helpful to hear what your perspective is.
Yeah, so as far as I know, the last JI policy guide, we were expecting DHCS to release aid codes for the members that would be transitioning, and that doesn't sound like it is happening anymore. So we are currently working on ways on how we are going to identify the members that will be transitioning out of incarceration, avoid that gap that Amber was talking about, because we definitely see that as well. As there's definitely a lag of them getting their Medi-Cal turned back on, and then they're usually, you know, straight Medi-Cal for a month, and then they're a direct member. So we're working on it. I know our justice liaison is trying to work with all of our internal departments here at Partnership to identify ways that we're going to be able to make that work, and especially at a county level, because every county is different.
Are there other organizations we should be talking to about coming in to join a JI conversation that, again, who's not at our table already, but that might really, you know, provide a new perspective and build some more collaboration? And I wouldn't be asking the outreach ambassadors necessarily to reach out. It could be that Health Begins does that outreach, but just want to see who else could we be inviting into these conversations.
What about parole and probation?
Great.
And I just wanted to share a quick, I'm come into quite a few roadblocks with their criminal history affecting them being able to be approved for housing, which I'm sure that's what you guys are all talking about. But you know, there was a law passed recently that they're not allowed to deny them based on their criminal backgrounds. Well, on depending on what the charge is, but I would like to know more about that if we could. I don't know, I was thinking about legal aid, if they could come and do. I know she spoke at another meeting I was at a while ago, but she did such a great job. But
was that legal aid in Reading, or
yeah,
okay.
Yeah, Sarah over at legal aid.
Okay. We can certainly ask her, and maybe she would be willing to come and help facilitate a conversation around the housing component of JI.
Yeah.
I like probation. I like parole. Those are all great suggestions. Anybody else folks can think about? Okay, well, we can start there and see where the conversation takes us too. I think this is a really great thing we can focus on.
Yeah, thanks everyone for sharing. We'll definitely think more about how to have this conversation in the way that's, you know, the most helpful and connects folks to resources. If we go to the next slide, please. All right, so next steps, we will have our session 8 office hours right now. Again, Point Click Care will be there. And then on Friday, August 30th at 10 a.m., there will be an optional office hours that is being hosted by our San Joaquin and Stanislaus Collaborative that is actually focusing on JI. A lot of the information is specific to the San Joaquin and Stanislaus counties. However, if you're interested in kind of seeing, you know, what's being discussed and where they are in that process, you're welcome to join. That might be, you know, informative as we kind of think about how to move forward in the Northeast. So the link to register is there. And then also, again, please register for our in-person session The link to register and the flyer are linked there, and I'll also be sending them out after the session. And then again, please schedule a one-on-one with our team as needed. We're here to support and help in any way we can. But thank you all so much for joining. We can go to the next slide. Yeah, thank you everyone so much. For anyone that wants to stick around for office hours, you can just stay on this link and we'll transition over. But otherwise, if you're hopping off, I hope you have a great rest of your week, and we hope to see you at the in-person. Thank you.
Thanks, everybody.